we're going to dive right in. If I can get the next slides, please, Jesse. I've been noticing all the questions in the chat about whether or not we are talking about MECFS this year and whether or not we're still advocating for MECFS. And I have to say, after all these years with all of this work, you really think I'd let you down, guys? Come on, my mom is still sick. I'm not abandoning any of these issues. We're just taking advantage of the change in the political environment to evolve our messaging to be get results. It's always about get results. So I just want to reassure those folks who are seeming concerned that MECFS is not being addressed. As we know, all of these complex chronic illnesses need the same support. So I love Jesse's idea about the Avengers. We're stronger together. Just because you have Iron Man doesn't mean Black Widow isn't still awesome. And she's also in the mix. So again, the one sentence that you need to come back to, and we repeat this many times, is please support the COVID-19 Longcallers Act. If you one more click, I think there's a little animation too for the quotes. There we go. So that is our one sentence, and that is our key ask this year. The COVID-19 Longcallers Act that I saw some people expressing concern, it is not the same bill that was introduced in 2020. I also saw questions in the chat regarding HR 7057. Again, we're in a new congressional session as of the end of 2020. The previous congressional session, the 116th Congress, is gone. We had new elections. Everyone comes back. So we're now in the 117th Congress. So we are working with Representative Byer directly to help him rewrite the COVID-19 Longcallers Act from 2020 and reintroduce it this month in its new form. And again, its new form is, you can see the bill summary that Jesse shared in your online tool portal. You can access it there, and that is the primary document we will be leaving behind with staff. Ready for the next slide. So to talk a little bit through the talking points, again, I also saw a lot of these questions in the chat. So specifically about citing our sources, I love that you guys keep us honest and put a lot of pressure on us to make sure we have that accessible to you. So to get to the specific talking points and where these sources come from, an estimated 25 to 35% of COVID patients known as long haulers, or the overall phenomenon known as long COVID, is this long-term effect after COVID-19 infections. There's a lot of amazing studies that have come out that show that the top 3 symptoms experienced by long haulers are fatigue, post-exertional malaise, and brain fog, which, as you know, are the top 3 symptoms in MECFS. While there are definitely and definitively cases of people getting MECFS as a result of their COVID-19 infection, it is not all folks. It still needs to be understood, but we really feel that we can use the research going into why some long haulers are experiencing MECFS-like symptoms, why some long haulers are experiencing POTS, why some long haulers are experiencing mast cell activation. All of these diseases were very overlapping even before COVID happened. So it really is an opportunity to peel the onion, if you will, and understand scientifically what are these mechanisms in the body that are causing these long-term chronic symptoms. I also want to add that the patient preferred term, just like in our community, our patient preferred term is ME. We use MECFS because it's the term that the government uses. Just like that, we want to be respectful to our friends in the long COVID community who may or may not have a form of MECFS. We don't know yet. Their patient preferred term is long COVID. Likewise, the NIH or government term is post-acute sequelae of COVID-19, or PASC. So just letting you know the differences in the terms there and why we're using the terms that way. Just to be clear, just like MECFS and the other complex chronic illnesses that are post-viral in nature, long COVID impacts all ages, races, and sex, regardless of initial infection severity. I will add there is some preliminary data that still needs to be verified that indicates that, again, like MECFS, long COVID tends to impact women more significantly. But until those studies are replicated, I wouldn't feel comfortable with sharing that information until we know more. But you can say definitively, and we do know, that MECFS does impact women more significantly at a 4-to-1 ratio compared to male patients. This next statistic and this next quote, long COVID may cost the US economy $4 trillion over the next decade. This down here is the exact quote that was said in an interview with Ovid Amate by Dr. Anthony Komaroff. You can see the link to the YouTube video right there. It starts at the point where the quote begins if you want to double check our work. And the quote reads, "The direct and indirect economic costs to the US economy from just the chronic illnesses that follow COVID are going to range over $4 trillion in the next decade." So that is a staggering statistic. There's another great quote that we can also share out with folks that this is a good alternative, also by Dr. Tony Komaroff in an opinion piece from Frontiers in Medicine that he authored on behalf of the US Clinicians Coalition for MECFS, co-authored with Dr. Cindy Bateman from Utah and the Bateman Horn Center. And this quote says that assuming that we reach 25 million cases, which we have, the basic numbers suggest that we will have a doubling of the US MECFS population, doubling of the US MECFS population. Let me say that again, in the next 18 months. So again, there is a very clear both scientific and anecdotal connection between MECFS and long COVID. We're hearing from long COVID patients every day as they are now beginning the same journey that many of you began when you first got that virus or you first had that initial symptom onset. And so I understand your frustration that you don't want to be lost in the conversation, but at the same time, there's a lot of people who are going through just what we went through, just what you went through, and we don't want to leave them behind. And if we can work together to get outcomes that improve for everybody, then it's in our best interest. We are the Avengers. We are stronger together. So the next series of talking points drill into a little bit of sort of the way we're structuring our case. So as you know, the first thing that a member of Congress will likely say when you raise this issue will be, well, didn't we just give you $1.25 billion? Aren't you done now? Don't we need to be that we don't need anything else? So we're going to cut that immediately by going to talking point 3, which says, thank you for helping to provide $1.25 billion to the National Institutes of Health to research the long-term effects of COVID-19. And then this section 4, or bullet point 4, but NIH research alone cannot meet this hidden wave, this need of long COVID and post-viral illnesses. People are suffering now, so we need additional action beyond just NIH research. We all know NIH is very slow. NIH is going to take years, maybe decades before all that funding is distributed, then more years before all of those studies are conducted, more years before they're reviewed and published, more years before the FDA reviews and approves that. So we're talking at least 5 to 7 years before anything tangible can really come out of the NIH initiative. But that doesn't mean there's things that Congress can't do now to really mitigate this crisis, improve, as you see, education, comprehensive care, and treatment equity. Those are the 3 things that we address in the new rewritten COVID-19 Longcallers Act. Just a quick, speaking of if you get any questions responding from the member or from their staff, if you get questions specifically about NIH, something like, what about NIH is this, or how can we prioritize that, or isn't NIH doing X? Refer them to this item in your handout. It's the third item in your handout. It's titled February 25th, Long COVID Alliance Recommendations to NIH. It is a 5-page letter that simply outlines all of the research priorities, including those for MECFS, suggested studies that we think are going to really help launch post-viral illness research into the next century. And so just refer them to that letter if they have those questions about the NIH specifics. And again, if you don't get bogged down by trying to answer them, if you're out of your comfort zone, worst comes to worst, just write down the question in your notes and make sure to flag it for our team, and we'll do our best to get back to all of the questions from staff. Next slide, please. All right, just once again, if you ever get stuck, if they're asking you about NIH, you don't know what to do, they're asking you about bill numbers you don't understand, if you ever get stuck, just go back to the one sentence. Please support the COVID-19 Longcallers Act. And in some cases in the House, please co-sponsor the COVID-19 Longcallers Act. Next slide, please, Jesse. So I'm going to discuss a little bit, because I can already see the questions popping up. What does the COVID-19 Longcallers Act do, and why do we care? So first, it's going to be introduced by Representative Don Byers shortly. As I said, we are working with his team directly to help repolish the bill into the areas that we think will be most effective to improving outcomes for patients. There's three sections of the bill that are actual sections, and there's the one section at the top that says title. So there's 4 total sections, and so those sections are broken down into these following areas. First is $30 million to the PCORI, which is the Patient Centers Outcomes Research Institute, PCORI. And that $30 million is specifically to research treatment is specifically to develop patient registries, data banks, data repositories, and biobanks to coalesce all of the data from all of the post-viral chronic illnesses in one place. As you've heard our Chief Scientific Officer, Dr. Sadie Whitaker, talk about before, we have the big data dream. We think that if we can combine all of this information from other diseases, from other MECFS studies, bring it all in the same place, start synergizing it together, we can really accelerate outcomes by pooling our common resources. So that is one of the areas funded by the first section through PCORI. The second section, it goes to the Agency for Healthcare Research and Quality, another $30 million. And this is specifically to research treatment efficacy, healthcare delivery, and disparities for post-viral illnesses. And I want to be clear, we have written into the bill very specific terminology using the terms post-infectious and post-viral illnesses, and specifically state mast cell activation, MECFS, dysautonomia, and POTS as the 3 areas that overlap in this space. And so all of them are specifically called out in the bill as these are areas that need to be included. So that additional $30 million doesn't just look at treatment delivery and treatment efficacy for long haulers, but it'll be using other post-viral patients like our existing MECFS population, our existing POTS population as comparison groups, so that we're learning about everybody holistically, because can't study everybody in a vacuum, right? You always need a control group. So we're really hoping to leverage that for the AHRQ studies. There's also a small segment in there for CMS that expands the current chronic illness tracking database to include MECFS and their post-viral diseases, which it currently doesn't, and long COVID. And also there's an element in there that that includes the sorry, I lost my train of thought. That includes access to care. So it studies whether or not people of color, people in low income, women, other groups, veterans, elderly, or disabled have trouble accessing services. And it provides instructions to the AHRQ to write recommendations to improve these systems and eliminate those barriers and disparities. The last component is another $30 million. We kind of went to the 30-30-30 area, is specifically to CDC, the Centers for Disease Control, and it funds 2 medical education, or 2 programs, one medical education and one public education, specifically about informing folks of symptoms, of treatment options, and last but not least, again, it's spelled out in the bill, related post-viral illnesses. So MECFS and POTS and MCAS are specifically highlighted as the 3 other related post-viral illnesses that need to be included in this nationwide medical education and public education program. So again, I appreciate your advocacy in making sure that your MECFS issues are front and center. I assure you they are. All of our community has come together in the United Avengers way to build this bill around all of our commonalities: medical education, disparities in efficacy and treatment access, and of course, data harmonization. The last point I will add is one of the most common questions folks will get when you tell them I'm asking you to support a bill is, how much does it cost? So if asked, but please don't say this in advance, but if asked, the price tag for the bill is currently about $95 million. Next slide, please, Jesse. And again, if you get stuck, or if anything is out of your comfort zone, always came back to the one sentence. And here's some 3 different ways to present that in case you're sitting bored of saying it the same way over and over. So obviously, the first way is please support the COVID-19 Longcallers Act. For people in the House, it can be please co-sponsor the COVID-19 Longcallers Act. Can we count on you to support and help pass the COVID-19 Longcallers Act? And of course, last but not least, will you speak to Representative Beyer about the COVID-19 Longcallers Act? Again, he will be introducing, we're working with him on the final language, hopefully this month. Jesse, next slide, please. Oh, yeah, all of the quotes. Sorry. So for those of you who are asking for an MECFS only and specific ask, that is also included. This is a secondary ask, and this is a one that's a little bit more advanced. So I say for the veterans. So specifically, Representatives Zoe Lofgren and Anna Eshoo, you may be familiar with those names since they have been our appropriations champions for MECFS for over 10 years. Representatives Zoe Lofgren and Anna Eshoo are circulating a sign-on letter for MECFS, which is included in your digital packet. That's the last item you see that says FY22 MECFS requests, or I think the title is something similar to that. That's the copy of that sign-on letter that will also be going to offices. You can add, please co-sign these important appropriations requests to continue and expand existing post-viral research programs that are already underway. Again, these slides are available. You'll have these, so you can keep these in your notes. And that is the end of our conversation. So I know there were a lot of questions. I answered over 40 before, and there's still over 70 that have come in. So I hope I answered a lot of those in discussing the specifics of the bill and the specifics of why we think it's a really good investment and why we're advocating for it. The other thing I will just add is I had some questions about HR 7057. HR 7057, while it was an amazing piece of legislation, was very small, very targeted, and NIH specific. So Representative Raskin has been very clear that he has no intention to reintroduce HR 7057 this session because it was only for 15 million, and there was already 1.25 billion given to NIH for this research area. So it would pretty much be done on arrival because it's duplicating investments that have already been made, at least from Congress's perspective. For those who are asking about a summary of the Longcaller Act, again, it is in your meeting portals. If you go into your meeting dashboard, you'll see those 3 documents. They'll be listed right there. You click on them and they pop right back up. And they pop up in new browser windows so that they won't interrupt your existing meeting if you're already in progress and you want to pull it up to look at some notes or for a reference. Okay, so I'm going to try and get through as many questions as I can, but I know we're already a little bit over time. We can also, for those of you who registered for this webinar in advance, we do have your email address on file, so we can email you back a response. But if you did not register for this webinar in advance, I highly recommend you come to our office hours with any questions we don't get to. Again, you'll see those in the links, and they're also linked on the website, www.meadvocacyweek.com. It's one Zoom link. You just click it, you go right in. Doesn't matter which time or which office hours you go to. We've tried to target the office hours for certain groups of folks who might have similar questions, but that's not a limitation. If you're not a person with long COVID, but you're only available for the long COVID office hour, come on in. We'll still be there to help you out. Let's see. Regarding some of the questions with meetings. So first of all, if you've logged in already and saw in your group that your group is very large, I know some of them are still very large. We're working on it. We're still shuffling meetings around and making sure that experienced advocates are in every meeting. You may notice if you did register as an experienced advocate yourself, that you may be in a meeting that's not your state or not your specific district. It's probably because that area didn't have an experienced advocate and your area did. So we reassigned you to an area of higher need. If you're uncomfortable with that, or you would prefer to stay in your own district, simply send us an email and let us know, and we'll try to find someone else to fill in that area of support. Also, regarding some of the meeting sizes, we're working really hard to keep meetings at the optimal 5-member group size. Most of them are probably between 5 to 7 people, but there are some folks that are a little bit smaller, some folks that are only 3 to a meeting, and some folks that are much bigger. There's some meetings as big as 14. So we're doing our best to try to chop those down to size. But if you do end up in a meeting that has a lot of people in it, it's probably just because a lot of people registered and we didn't want to tell someone they couldn't come. So if you do end up in a meeting that's one of the larger sized ones, if you're just don't want to say anything, you can always just say that one sentence, introduce yourself, and then step back. Especially for folks with energy limitations, this is the best way to participate, especially have a lot of meetings going on. And then last but not least, Jesse, I think there was one final slide that was just a reference slide. if we could share that one too. Oh my goodness. Okay, so I'm still trying. Over 80 questions now. Sorry, I'm trying to get to as many as possible. This is a great one from Anne. Are there any ground rules for groups in the meetings, e.g., don't share your personal details about people in the state or social media? Should we only be sharing info we'd be comfortable with others in our meeting sharing publicly? That is a great question. So typically meetings, especially meetings with a member of Congress, are considered somewhat confidential. It's okay to ask to take a picture. In fact, if you want to take a Zoom capture of you meeting with a member of Congress, that's super fun. And it's always cool to put that in your Facebook photo. I think I have a photo of me meeting with Elizabeth Warren because I was really excited about that at the time. So things like that, yes, is totally appropriate. But information that people share about their stories, I would consider that confidential. This is, this is not an internet space, even though we are participating on Zoom or a phone call. Some folks might share some really deep, personal, touching information, and that may not be appropriate for you to share on the internet. When in doubt, you have your messaging system. Feel free to ask. Just send a message to the person that you're concerned about. Say, hey, I really like that story. Is it okay if I share it? If I don't use your name, something like that. Just when in doubt, ask them or ask us, and we can happy to make the connection. But I would err on the side of caution about sharing things publicly rather than regretting that later or hurting somebody's feelings, or worse comes to worse. Oh my goodness, this is one thing I also want to share. Be gentle about sharing people's group names. Specifically, some folks who are receiving disability have limitations about being able to participate in work-like activities. So again, just err on the side of caution. You don't want to be the one who inadvertently or accidentally cost somebody their disability insurance, or that might be their main line of survival. So I would say when it comes to sharing other people's personal information, ask first. I saw a question here about when you're put in the contact of team lead, if you have a previous relationship with a member of Congress. That's really helpful. Thank you for that question, Brad. If you do have a personal relationship with a member of Congress or staff, and you are in that meeting, I highly recommend bringing it up. You can say, oh, hey, you may remember I met with you last year on this issue or something like that. That's always a good thing to know so that they understand that pressure that we're not giving up. We're going to keep coming back. That's always really good. However, when it comes to the scheduling aspects, are we meeting at 3 o'clock? Did the meeting change? Please let that exclusively go through our scheduling team. As you've seen through your online portal and your meeting dashboard, we have a really cool high-tech system this year that allows you to navigate and share all this information. But if you talk to your members of Congress or their schedulers outside of that meeting schedule, we don't know about it. So it's best if you do it, let us handle the scheduling aspects so we can make sure all those elements are consistent. But regards to policy issues or sharing your previous work with an office, that's a great point to make. Okay, I'm trying to go through. One of the questions was, is this just a phone meeting? Yes, we are doing all of the meeting virtual this year to protect your health and the health of staffers. I'll also add that additionally, the physical space on the Capitol Hill is restricted from guests right now. It used to be, even with the COVID protocols, that an office could meet you at the door and escort you in. But now there is no guests whatsoever after January 6th. So even if we did have the resources to meet in person, we wouldn't be allowed to. So all of these meetings are taking place either by Zoom or conference call. Some offices do not use Zoom, they only use conference call lines. So again, I urge you to check in the left-hand corner of your meeting portal and your meeting dashboard, where it says the name and who you'll be meeting with. If it's a Zoom, that link will be embedded. You just click that link, it'll pop right up, nothing else to do. If it is a phone call, you will need to dial in and then put in the access code. If you're not comfortable with Zoom or would prefer not to have your camera on, that's fine. You don't have to have your camera on to participate. Or if you don't feel comfortable with Zoom, there is the dial-in alternative. So even if you are dialing into a Zoom call, you can still use your phone to participate. Okay, so I saw a question here from Christine. In December, Congress provided 1.25 billion in funding over 4 years to NIH to support research into the long-term consequences of COVID-19. How is this related to HR 9027? Well, first of all, HR 9027 does not exist in this session. Again, that bill was from the 116th Congress, and it's being reintroduced in new language in this Congress. So we are supporting the new rewritten COVID-19 Longcallers Act that does not yet have a bill number because it has not yet been introduced. And related to how is the funding for NIH related to this bill? Well, the original bill, HR 9027 that you reference here, did include funding for NIH. Obviously, that would not pass now because I imagine Congress would say, we just gave you $1 billion, you don't need any more. So I think that that would be the relationship, is that the bill has evolved because the situation has changed. There's new information, new funding. The pandemic is in a different place than it was then, and our funding and resources are in different places than they were then. So again, the new rewritten version, which is the 95 million version that we've helped the Bayer team rewrite, and it specifically includes the medical education, data harmonization, and disparities and health access research components. All of those are in the new bill, which is in the summary, which again will be introduced. One of the reasons why Representative Bayer has chosen to hold back on introducing the bill quite yet is, one, he wanted to ensure that all of the parties had a chance to review it and approve the legislation, which is great. And so we were really excited for the opportunity to help guide him in how to invest in these programming areas. The second is that he wanted to coordinate with us. So one of the purposes of us having our advocacy day before he introduces the bill is to drum up as much support so that when he does introduce the bill, he'll have a lot of co-sponsors and it'll have a larger chance of success by having a larger contingent behind it at the beginning. Let's see, I saw, so one thing I just want to add, for some folks who may be a little confused about why if you type in your email, you're not getting a portal back, it's probably because you're not registered. So everyone who is registered, especially folks who registered most recently in the last 6 to 8 days or so, you should have received either an email from Jesse or an email from myself with information about Advocacy Week. Some of them were called your guide, some of them were called your portal is now live, but you should have been receiving those emails pretty steadily after your registration. If you have not been receiving those emails, or you never received a registration confirmation, you are not registered for Advocacy Day, and we do not have any meetings for you. Only people who registered in advance have meetings and have access to the portals and can participate in these events.
And make sure you're, oh, sorry, Emily.
No, go ahead, sorry.
Make sure you're checking the email that you use to register. I know some people have a few different email addresses, so make sure you're using the email that you use to sign up for Advocacy Day.
Great, thank you so much. I see a question from Rick. Are there maybe going to still be changes as late as Monday night before Tuesday? So our schedule could change the night before. Yes, unfortunately, Rick, yes, that is possible. We're working with the offices to really diligently to try to finalize everything by Friday. And I'm still like kind of micromanaging some of the groups and moving bits here and there as meeting times changes and conflicts erupt. But hopefully, fingers crossed, all of your meetings should be finalized by end of day Friday. And we are sending you will get a second email also from Advocacy Associates with a PDF attachment on Friday afternoon. That PDF attachment should be your final meetings. Again, it's possible that there might be some last minute changes on Monday or Tuesday, but we're really doing everything we can to make sure that everything is locked down by Friday. Excellent. I'm just going through some of these questions. Oh my goodness, thank you for everyone's comments. Bob saying we should sign in 10 minutes early. Yes, team leads, if possible, please sign in 10 minutes early. Again, if your energy or meeting time allows, mainly just because we want to make sure that when our new advocates arrive, and we have a lot of new advocates this year, they're not just sitting alone in an empty void. We would like to have, if possible, have our new advocates have somebody experienced already on the line by the time they call in 5 minutes early. So if you are a team lead, which means you're one of those experienced advocates who signed up and volunteered to help others, please call in about 10 minutes early just to be a resource for our newbies. And I'll just also add that it's amazing how much we've grown. I got some questions in the chat about what the size is for this meeting, and it's intense. So by way of reference, last year was our biggest advocacy day ever. It was the 4th annual advocacy day, and we had 354 participants. This year is our 5th annual Advocacy Day. We have 907 registered advocates as of this morning. So we have more than doubled our numbers, which is why you might be noticing that the groups are a little more challenging logistically this year, but we're doing our best to make sure that everyone is included, that everyone has at least one meeting, and that every new advocate who checked themselves off as their first time participating has an experienced advocate in the same group to help guide them. So I know we're already a little bit over time, so I'm just going to take this one last question, which I think is very interesting. Could you please provide a talking point and source citation for the point you noted verbally, Emily, connecting MECFS with long COVID? Yes, I'd be happy to share that. Again, a lot of that information is in this third item on, or sorry, this fourth item on your screen here, the February 25th Long COVID Alliance recommendations to NIH. A lot of that information, including a lot of source citations, is in that letter. That's probably the best place to go to get that information. But if you still feel like you have questions about the scientific connection between MECFS and long COVID, feel free to drop us a line, and I can either send you to our research team, who will inundate you with tons of studies, or I can try to give you a quick summary based on what I've learned from our research team. So with that, I'm sorry, I know there was over 140 questions submitted, and I'm sorry we didn't have a chance to get to all of them, but if you still have questions that were not answered, join us for the office hours. We start tomorrow. We have I guess it's over 6 hours of office hours available if you count the social event too. So lots of time for everyone to join, get that one-on-one attention you need. And again, my email address is etaylor, E-T-A-Y, sorry, I'm forgetting my own name today, ETAYLOR @solvecfs.org. You can also ping us on Facebook. We also have, for those of you who may not be aware, there is the 2021 Advocacy Day Facebook group, which over 400 folks have already joined. So you can also communicate through that area. And sorry, one last point. I know I said I'd wrap up, but I just wanted to also note, I got a couple questions about privacy and communications. So we have a very strict privacy policy here at SolveME. If we have your contact information, we guard it very safely, very closely, and will not share it without your permission. So you may have noticed on the registration form this year, there was a new question that said, I give my permission to share my contact information with other group members. So if you checked yes to that, and one of your members of your group asks for your contact information, we will share it. However, with the messaging system, which you may have noticed is internal to the portal, none of your contact information is shared. So I recommend messaging each other through the messaging system. And as you saw with Jesse and I messaging each other, it's pretty instant. And also the messages do stay and they are saved. So if you send a message to like your group leader today and they log in tomorrow, they can respond almost like an email. It'll come later, but it is inside the congressional meeting template and the congressional dashboard, or sorry, the meeting dashboard. So so you'll need to sign in to do that. And okay, that's the last one. Sorry, I will end there. So thank you all so much for joining us for this training. Again, we are here to help in any way possible. We have office hours, both our emails, and all of these slides, this recording, and the transcript of our conversation will be available at www.meadvocacyweek.com. Thank you all again for your time, for your generous use of your energy, volunteering to take action on this really important issue, and really excited to get some improved medical education and some improved data harmonization out by early next year. So thank you all so much and have a wonderful week.
Thank you.